My name is Arlene Chandler, and I serve as infection preventionist at English Oaks Nursing and Rehab, and I've been employed with Generations for 8 years. My main role as an infection preventionist is to direct and manage the infection control program at English Oaks. I work closely with the departments and train regarding department-specific infection prevention practices, and I continue to maintain our plan of correction for our 2016 state survey. As a nurse, I love being hands-on with my patient, and I feel I make a difference when I empower my patients and co-workers through education. When I receive a patient and they get diagnosed with a multi-drug resistant organism, and we have to initiate transmission-based precaution, during that process, I like to educate and comfort the families and patients to make them know that they're not alone in this process. And I like to leave my patients and families knowing that they are confident in their care when they are staying here at English Oaks, and just to remind them always that they're never alone in the process. And I believe I make a difference in that. I believe I work with the best of the best in the industry, and through my leaders and mentors' guidance and leadership, I believe that I am the nurse, the professional, and the leader that I am today. As a professional, I try to maintain my professionalism as an IP nurse. I try to be a leader that listens to her patients, families, and coworkers. I try to be a mentor that lends a helping hand. And as I enter the facility, I always try to embody kindness, competence, and compassion, and I'm able to do that through the guidance of our mission statement. What it means to me to be a recipient of the Presidential Award is that it validates my hard work and dedication for our company. And I believe when you allow the mission statement to influence your work, it only benefits the company and allows us to shine. And I'm thankful for all the great leaders and all the mentors that I've received working for the company, and this will continue to encourage me to work hard in my roles at English Oaks.
My name is Noel Mulato. I'm working as a CNA here at St. Francis Pavilion. I'm working here for almost 15 years. Being a CNA, I love serving and taking care of my residents and their families. Especially when I see my resident happy and contented, I feel rewarded. The favorite part of my job is meeting new people, because meeting new people, I've learned a lot from them. The mission statement of it is very important. It's a way of life, and it's our heart and soul, because the mission statements give us inspiration to give excellent care to our residents and their families, and with a great respect and dignity to them. One of the situations that I made difference to my resident, there's a newly admitted resident here in our facility, and should have no idea what kind of work that we have, what kind of way of life that we have in here. So I entered the room and she started crying, and I asked her what can I do to help her, and she told me she's missing her family. So I went there. I tell them that we are your family here, and make sure that you will be made comfortable during your stay here until you get well. When I was told that I was the winner of this Presidential Award winner, I was shocked and surprised, and it's my honor and privilege to have this one-in-a-lifetime achievements award. And I would like to take this opportunity to thank Generation Healthcare, the employee, and also the resident who supported me in achieving this award.
My name is Daniel Japson. Currently, I'm the Assistant Director of Nurses here at Cedar Crest Skilled Nursing and Rehab. My major job responsibilities here at Cedar Crest is to make sure that all our nurses, CNAs, are performing their best in patient care. And one of my job is all the patients are receiving the quality care that they deserve every single day and every single moment. Every moment that I feel that I always make a difference is every time that I go talk to the nurse or all our nurses, our staff, and always remind them that I'm your ADON. I don't look at you as an RN or LVN, but I look at you as a nurse who is compassionate, a nurse who is caring, a nurse who is there to help the patients. You know, I mean, hearing those words from me actually, you know, makes a big difference on the floor, you know, because they don't, every one of them are equal. You know, they deliver the same care, they deliver the quality care that all our patients deserve. So this is what I always tell, you know, all the nurses who comes here at Cedar Crest. I don't care if you're an RN or an LVN. All I care about is if you're a nurse or not. I live the mission statement of Generations Healthcare every single day that I go here to the facility. I deliver care not only to the patients but also to the staff members. Everyone that is in the building, we treat them as customers. We treat them as a family. There's a point in my life that, you know, I looked at Generations Healthcare, especially Cedar Crest, as my second home, in which every single one that is in here and lives in here, or a patient in here, is actually a part of my family.
My name is Maria Lourdes S. Rosario. I'm the Director of Staff Development and Infection Control Nurse at Plumtree Care Center. Being a DSD, my job entails a huge responsibility. When I come in the morning, I check the staffing, make sure that it's adequate for that day. I make sure to make rounds with the residents to make sure that they are properly dressed and to do their ADLs. In the afternoon, I give in-service trainings to all the CNAs and emphasizing the infection control provision and the stress prevention in a daily basis. I make a difference when I empower all the CNAs to do the best that they can do to make the residents feel good and be assisted. I think I make a difference when I pat the CNAs on their back for doing a very difficult job. Everybody deserves to be acknowledged, especially the health workers, and made importance at all. We are caring for a lifetime of memories, a lifetime of care, a lifetime of love. These are very powerful messages, and I really live it. I am very proud to be a Generations Healthcare employee. I was so surprised when I knew that I was elected as a nominee at first. And when Elena brought it up in the stand-up meeting, my heart was just pounding, and I really appreciate how they made me feel that I am important. And the hard work that I provided with the residents had really made a difference. I would like to acknowledge our administrator, Elena Sfrijan, who tirelessly mentor me, who support and loves everybody here at Plumtree Care Center. She is a role model, a true educator. She is so pure on what she has as an administrator and as an educator.
I'm Moises de la Cruz, housekeeping and janitor, and I'm working at Vista Manor. I would like to thank for this facility for hiring me, and I'm going to continue my best as I can to do my job, my works. I love the work. I'm making all the cleanliness in this facility. I will all make sure that whoever enters the generation home will be met a kindness, confidence, and compassion. Smile, yeah, smile, and you have to show them your respect and love. I would like to thank to Mr. Luis Valenzuela to give me this opportunity, and he's giving me all the best he can to do my job as well. So I would like to thank to him for inspiring me all the directors and the administrator, and to my fellow co-workers. I can speak, speechless, right? When I heard that. So maybe I have to continue my work for the best and the best.
My name is Jesusa Estropia. I've been working at Pleasanton Nursing Rehabilitation Center as a CNA for more than 5 years now. As a CNA, I work under the supervision of my nurse to deliver the high-quality care of service to my patients. I help my patients with their daily living, such as feeding, dressing, bathing, make the room clean, and most importantly, I answer call lights for their health. For me, I provide the good service for my patient, not because it is my responsibility, but it means a lot for me because I help them for my heart. First of all, I would like to thank the management and my co-workers for this Presidential Award, as well as our residents and their family for their kind words. I was really surprised for this award, and I appreciate this recognition very much. Prior for this informed about this award, I already filed my dream vacation, which I and my husband have planned last year. So coincidentally, it is unfortunate I cannot attend this awarding. During the interview about this my work, there was a questions, how about I made a difference with my residents' life? I always believe this customer satisfaction is I achieve both, and the residents and the family have kind words for me. I know I made a big difference in their lives when they feel they are very taken care of, and especially when you earn their respect for you. Smile is always a big factor when providing the service regardless of any situation. I also need to be enthusiastic, which I do every day, as make us work easy. I know sometimes it is stressful, but loving your work encompasses my problems and energizes me every day. This award provides more encouragement for me to do my job even better. As I always believe, continuous improvement for me. I thank God, my children, and especially my husband, who has always supported me in my endeavor. Thank you all.
Malu, my Director of Nursing, and I are here today to talk about our presidential winner, Gurley Kaluanan. Is that right?
Yes.
She doesn't want to be on camera. She's a very humble person. She does not like the attention that she gets, but she gets the attention because she's so good at her job. She's been an LVN with us for a long time. She's not officially classified as a supervisor, but whenever we need someone to step into a supervisory role, she does so. And that's one of the million reasons that we decided to make her the Presidential Award winner.
Number one that I've seen with Gurley is that we have a volume of admission and discharges at the same time. The first thing that I answered Michael is that she never complained. That's the word that I said right away.
The very first thing that came out of Malu's mouth is, she never complains. And that's something that any boss, any supervisor wants out of those that work underneath them, is to not complain. But not complaining is one thing, but actually doing a good job is another. And she doesn't complain. She does an incredible job. And, to her point about admissions, when you get a lot of admissions, a lot of discharges, that, as an administrator, I'm excited when we get a lot of admissions. The nursing staff, not so excited. They understand that that's part of the business and a very important part of the business, but a lot of nurses will, when they see 6 admissions coming in on the same day, you'll see their shoulders slump, and they're like, oh my gosh, this day is gonna be awful. You'll never see that from Gurley.
Okay.
I'll tell Gurley we've got 5, 6 admissions tonight, you're gonna be okay? And she looks at me like, why are you
Bring it
asking?
in.
Yeah, why are you asking? Of course I'm okay, this is my job. there's different types of leader. There's formal leader, there's informal leader. I think Gurley is an informal leader because as we've talked about, you know, it's a high stress thing when you have a lot of traffic going in and out. But when you have somebody in a supervisory position, like we often put Gurley in, and the rest of the staff is going to have to follow that person's lead. And if you're following Gurley's lead, you're going to be calm, you're going to be collected, and that's so important, especially with the family members of new admissions, because oftentimes it's an unfamiliar environment for them. They've never seen anything like this. So if they see that the people in charge and the people taking care of them are, you know, completely calm, and, you know, even if there's
Yes.
chaos, if things are flying around,
Organized.
and the rest of the staff follows her lead. She's not a vocal person. She'll be vocal when she has to, but she rarely has to because people really do follow that lead by example.
I was honored about a year and a half ago to be approached by the administrator, Tim Castleman, to be the medical director here at St. Francis Pavilion. And under the principles of Generations Healthcare, as well as the guidance of Tim Castleman, good patient care is the main principle to follow. And what I've noticed is that the staff keeps that in mind, from the nurses to the therapists to the CNAs, all are dedicated to providing good patient care. And then what I've noticed is that makes everything simpler. The judgment, the decisions, all following that good patient care principle is what seems to win here, and I've seen good success here with the patient care. The other aspect that I notice here is we recognize that we are taking care of both patients and families. For most of the patients, the staff, including the doctors and nurses, are new to them, and so we go to great lengths, the social services department, to communicate with the families to make sure that we're taking good care of the patients, and I see that from the top to the bottom of all the staff.